my name's Jenna Gibbs. I'm the Director of Operations at the Ag Health and Safety Alliance. We are a nonprofit organization focused on training the next generation of farmers and producers. We work mostly with college agricultural students, but we also do some veterinarians as well. We're really excited to be here at the forum and presenting on this poster, which of course is too small to see here, but should have a copy in front of you. The point of my discussion today is just to go over the poster's main points. Our poster came from an emerging issues proposal from the Upper Midwest Agricultural Safety and Health Center. This is located at the University of Minnesota. We received a grant from them to include more zoonotic disease and antimicrobial resistance training as part of our Gear Up for Ag program. This involved partnering with a veterinary resident at the school who helped us develop evidence-based content. So we are really, really appreciative of that partnership. To date, we've trained more than 250 students across the United States. All of these students are directly involved in agricultural production, and most of them are, in fact, livestock students. We've evaluated the new curriculum and its effectiveness by two methods. We always use pre- and post surveys before and after our training to obtain quantitative data. And then we also obtain qualitative data, which may be stories or feedback shared in chat if the Gear Up for Ag is held virtually. But also we've been using handwritten Post-it notes in some of our live trainings, which has been an excellent way to get qualitative feedback from the participants. Our findings: over 250 people have been trained in zoonotic disease and antimicrobial prevention. We've found that around 11% of the student participants self-report having been diagnosed with a zoonotic disease. However, about 1/3 or 29% of them are unsure if they got zoonotic disease. So when we talk about this in the qualitative data, a lot of the students say they were working with their animals and got sick, but were really, really unsure since they had not received any kind of diagnosis from their healthcare provider. So higher percent of students think they may have gotten sick, but were a little unsure. And then we asked a little bit about sharps handling and working with pharmaceuticals, and almost all the livestock students report working with sharps. I think it was around 92%. This work with sharps and needles begins very young. About 66% of those working with sharps started doing so before they were even 14 years old. We have a lot of qualitative stories on needle stick injuries, and a lot of it has to do with being in a hurry and having to vaccinate or administer pharmaceuticals to a large amount of animals in a short period of time. The next steps from this are to continue targeting these young adults working with livestock and focusing our attention to the definition of zoonotic disease. We found that a lot of participants really don't know what it is or are a little unsure of how they can contract it from their animals. So we focused a lot more on that One Health model training and just raising awareness about that. And then our whole program really focuses a lot on personal protective equipment, which can serve as a really great barrier to protect you when handling biological specimens or working with sick animals. And then lastly, we recently applied for a grant to modify our Gear Up for Ag program to train more large animal veterinarians, since this could be a huge concern for them as well. So we're really pleased to be nearing the end of this project. We've collected a lot of data. We'd like to thank our partners. This whole project was funded by an Emerging Issues smaller grant from one of the NIOSH Ag, Forestry, and Fishing Centers at the University of Minnesota. So we're appreciative of that funding. And we also would like to thank 3M. They always do a great job of giving us personal protective equipment so that we can give PPE kits to all of the participants in the Gear Up for Ag program. So thank you for listening about our poster, and I hope that you guys continue enjoying the forum, and we will see you next time.